The past 5 years have been overwhelming for most people. The impact of COVID and lockdowns, then tensions flaring on the international scene, with the Russian invasion of the Ukraine, the October 7th attack on Israel, followed by a divisive U.S. election campaign, our own federal leadership woes, a government in crisis because of leadership or lack thereof, the inauguration of Donald Trump as U.S. president, his tariffs and trade wars, inflation out of control, market crashes, job uncertainty. What is this doing to the mental health of Canadians? Well, Greg Zed has spent a lifetime in the field of mental health and addictions and is a forensic suicidologist. Greg joins us now from his home in Rothsay, New Brunswick. And Greg, thank you for being with us here this evening. Looking forward to a good discussion on this whole issue, because I know even I have been, in the last couple of weekends at least, trying to, shall we say, de-Trump, de-tariff, by just trying to ignore the whole thing and trying to regain what little bit of sanity I've ever had. So is it really, are you sensing that it's becoming a real issue, this whole fatigue thing and what we've been going through for the last 18 to 24 months?
Yes. Well, thank you very much for inviting me on the show. And I would have to agree that your intro certainly laid out for your audience the fact that there is a fair amount of negativity in the world and around us. And I think I'd rather look at the glass half full than half empty in the aspect of it, insofar as what can we do as human beings to combat it. You mentioned earlier about I'm in my 51st year working in the addiction and mental health field, and including reviewing for well over 2 or 3 decades suicides within our province, causation, et cetera, et cetera, et cetera. And I will say this, that we are seeing an increase in what we would refer to as people that are somewhat depressed and anxious. Doctors, for example, are saying 80% of their practice now is seeing people that are depressed and anxious. What we haven't really seen yet, which is kind of interesting and it will take time, is we haven't seen a negative consequence to that insofar as it hasn't had a dramatic increase in suicide rates, for example. That would be, if you want, the worst case scenario. But what we do have is we have an increase in youth mental health, and schools are trying to get a handle on that. And we're having also an increase in depression, anxiety, and the Canadian Chamber of Commerce will report also the fact of absenteeism and people using sick time. So it's certainly playing on the Canadian economy. And for lack of a better phrase, the outcomes are there is an increase.
What, Greg, what should we be looking for as far as any kind of signs that either personally we're having a tough time dealing with something, or somebody very close to us is having a tough time dealing with everything that's going on? They're overwhelmed.
Well, certainly listening to them and having an empathetic ear is very important and show concern. And people will, if given that opportunity, will share with individuals such as friends, their clergy, their neighbors about that hard time. And I think when that is explored, then you can get into, without getting too clinical here, you can get into well, how bad is it? What's been going on? And really trying to get a measurement of how bad it is. And then and only then can you take a look at where next should you refer the person, whether it be to their family doctor, um, or a family friend, or their local mental health clinic, etc., etc. What I would guard against is we don't want to medicalize everything that is wrong with the world. And there is that um, uh, possibility that everyone's depressed, everyone's suffering from anxiety and depression, and we'll just literally and figuratively fill up hospital ERs. And that's not what we want. What we really want is community based interventions that can help us all control the controllables. So, therefore, it's always good to get groups together, say, for example, in your building or in a local community, to talk about what are the ways we can manage stress, for example. Managing stress would be at least the beginning of what do we know about stress, what can we do as human beings to deal with stress, and what are the outcomes that we can measure, if you want, um, in terms of am I doing it effectively?
Now, is it hitting any particular age group harder than others? But I know you mentioned the youth, and as you're growing up, you're going through a lot of pressures from the outside, and now they have to deal with all of the pressures of social media as well. But even on the other end, there are adults who get fully involved in the world of social media, and that has to pile on the negativity that is there every day, has to pile on as well. But is it across all age groups, or are there a couple of age groups in particular where you're seeing it?
A third of each of the categories. There's no question that youth are having an increase in, let's just say, mental health issues, but many of them are managed quite well by organizations like the Canadian Mental Health Association that have coping mechanisms, whether it be in the school system or guidance counselors or things like that. So that is one layer. The other area is, of course, um, again, staying away from medicalizing everything. Um, it's not that we have an increase in mental illness across. Like, for instance, I'm heavily involved with the Schizophrenia Society of Canada. And I know, and I don't speak for them tonight, but I would say this: COVID has certainly seen people that are vulnerable fall further and further behind. People with poor economic means, we see the homeless, which I've never witnessed. In my practice, I have never, when I worked with the health authority here in St. John and the greater St. John area, and then in the Sussex area, I've never seen a tent or a sleeping bag in terms of a social housing crisis. We had affordable housing, and we had rent control to a certain extent, and we would have people that would get a subsidy from the Department of Social Development, and they would get an apartment for I would say $400 or $500, and the formula was they would pay 30% of their maximum gross income. Today, the average rent, when you're talking 12, 14, $1,500, it's no wonder we have so much homeless people. Now, that doesn't translate necessarily to a mental illness, but it is a determinant of health, and not having stable housing is over the long run going to impact the mental health and well-being of individuals. That's one example. But getting back to the approach, it's got to be control the controllables. So getting the group together, if you want to make sure that you're doing everything to possibly work at having proper sleep, proper recreation, proper nutrition. And only after you get those things under control um, can you look forward with other ways and means of dealing with the stressor at hand, including shutting off social media.
Yeah, and Greg, that's actually a big one. I've actually tried that where, you know what, both my wife and I have had enough of. I mean, a lot of the chaos that's happening in the United States, we've literally shut off the television for a good year. We did not listen to the news. We did not pay attention to social media streams online because both Manel and I found that was really impacting our own mental health. And no matter what we try to do to filter through some of the craziness that was actually being thrown at us by mainstream media and social media platforms, we just couldn't filter it out anymore. So we literally had to shut it off. So, Greg, what can you say to our viewers? You know, on top of the three items you just mentioned that are on the forefront of getting your health back together before tackling the mental health issues and the stressors that we're seeing on social media. Sometimes it's just very difficult to turn it off. It's almost like a moth going into the fire in a lot of cases because A, it's informative, B, it's entertaining, and C, at the same time, it ends up being very stressful. What can you recommend to our viewers on how to cope with that? Because it's very tough just to shut everything off. Not everybody's like my wife and I. Some people are drawn to it. What do you suggest they do to minimize the amount of stress that they take to bed with them?
Well, I would say right off the bat, the first thing that they have to do is they have to control the controllables. And I don't think many of us really want to. Um, what you want to do is we don't want to think that we can control the controllables. For example, having effective and sleep. If you're not sleeping properly, that really runs against all principles of stress management because it's very much related to heart disease. So, for example, if someone's not sleeping, they could have a sleep disorder. They have to get that um, underway. The second thing, of course, is the proper nutrition. And we could easily say, well, in today's economic world, it's hard to buy healthy food. But
Right.
if you plan your meals and try to get your proper nutrition and realize that food and nutrition does play a significant role, that is, again, you can control what goes in your mouth and not feed off of tendencies to grab onto chips and junk food and things of that nature, because we do know that that does affect your mental health and well being. The
Hmm.
third one, which people tend to neglect for whatever reason, is recreation. I mean, walking is so effective in controlling one's mental health and well-being. Um, Research galore, and not that I lean on academic um, research all the time, but it's demonstrated long and hard and longitudinal studies that walking as much as 20 minutes a day is very effective. Um, so that there is three things. The other thing that I think we have to be careful about is being drawn into negativity. And
Yeah.
you often hear about toxicity. Why hang on to it? If if you're in a toxic relationship, easier said than done. But toxicity has no role to play in our well-being, and so therefore, if you control the controllables, you have to more or less get away from any toxic negativity that'll just drag you down
Yeah.
psychologically. So there's four things right off the bat. The fifth one that comes up from time to time is to be aware of your genetics. And, we can't control genetics, but we can know about it. So make sure you have a health care plan with your physician and, get proper, I'm not saying you should run like lots of people and automatically get blood work and whatever, whatever, whatever. But that whole notion of preventative care and looking after ourselves, and dare I say, at both Gary, you and Eddie's age, I would hope that you'd look after your health because it's the only thing you have. Because without health, you have no mental health, or
Mhm.
vice versa. Without mental health, you have no health.
Yeah, thank you for that, Greg. You know what? It makes a lot of sense. I'll be the first to admit that sometimes I'll get depressed about this, that, or the other thing, and kind of drag it on for a couple of days, and maybe I'll give Gary a call and talk some of the things out, which does help. But you know what? I'm guilty of one thing you just said. Physical health before mental health, and you know what? I very often put it on the back burner, and you're probably right. That probably contributes to my to the status of my mental health. So I really appreciate that suggestion and comment, Greg. Very informative.
Well, the Coalition for Mental Illness and Health has been advocating with the federal government now as long as I can remember. I think at least the last 8 or 10 years. Um, Certainly parity. And
Mhm.
interestingly enough, not to sound the alarm about mental health, but when we look at budgeting, um, mental health is always as they say, and I don't want to get into this poor cousin syndrome, but it's not financed and it's not funded at the same level as physical health, and it's not as sexy. And so, therefore, other very, very serious illnesses like cancer, for example, a heart disease, et cetera, et cetera, et cetera, um, certainly often take the lion's share of a budget. And I would hope, for example, the federal government, the new government, even though they didn't go back to a minister for mental health, that the
Mhm.
health minister has enough um, um, people to influence around things like advocacy to access to good, proper mental health.
I see.
Now, Greg, you mentioned earlier about the fact that the number of suicides, there's been no appreciable increase as we go through this period that we're going through. What would be some of the signs that we should be watching for in a family member or a close friend as far as looking at, are they ready to take that turn down that dark road? What should we be looking for, and once we identify it, how do we handle it?
Well, it's not an easy one, but I'll say this, that in the suicides that I've reviewed, every individual who is suicided has left a cue or a clue or whatever. And the guilt is with all of us where we miss something. How do we miss it? So obviously, if someone is feeling bad, you might want to gauge that. How bad is it? Have you ever wanted to kill yourself? And to a great extent, nationally, we have a program which is referred to as the Assist Workshop, which is applied suicide intervention skills training. And it's in every community across, um, actually, not only across Canada, it's international. And people are trained in doing that. And we're talking lay people to do an intervention. And that will intervene for that moment in time. And if you can think of it like someone drowning in a river, and you do the intervention and get them to shore, then the ambulance comes, and then after the ambulance comes, they get to the ER, and then after that, they get into mental health, and that would be the first thing. So certainly take them seriously, talk to them in a non-judgmental way. And when I say non-judgmental, um, if you're feeling that they're quite serious and they want to kill themselves, like, ask them, come out and ask them. And I've never met anyone in the 51 years that I've been involved that if you ever ask someone, how bad is it? And have you ever thought of suicide? They actually will feel relieved that someone has taken them serious enough to ask that question. And then from there, it's a matter of getting the appropriate help at the intervention. And that is why I say the parity is important, because we have to have access. It's great for people to run around, and I'm not criticizing advocacy groups who talk about suicide awareness. But okay, then after awareness, is there treatment? Adequate treatment? Do people have access like we have for physiotherapy, 10 or 8 sessions? Or can you
Mm,
go in? Is there a mechanism, or do you have to have a benefit? Is it easy to get mental health care without saying you have Blue Cross or you have,
right.
you know what I mean? I often subscribe to the fact that it should be like Medicare. If you go in for Medicare and you have a broken bone, I hate using that comparison, but at the hospital, they don't ask you your Blue Cross number. Your bone is x-rayed at no cost. It's free in the healthcare system. So I think we have to almost get a parallel parity system for mental health. And this notion about, oh, we're understaffed, I don't buy that for a minute. I spent,
Really?
as I say, 42 and a half years in the formal system, Gary, as you know, here in New Brunswick. And I think we have plenty of staff. It's how we use our staff. And, throwing money at it with the same outcome is not the solution. You got to be creative of how do we access, what do we have access? We have that 988 now, the suicide helpline nationally, and we can't give up on it. I mean, there's so many families in Canada. We have a suicide every 142 minutes in Canada. So we're talking about 4,500 people in Canada died last year, and at least 10 or 12 people are affected. So it's 1 in 10 almost in Canada. And those poor families are suffering because they have lost a loved one, and the stigma associated with a funeral, the compromised rituals. You go out the street and you say, "Oh my God, oh, your brother suicided," and all that plays a factor in it. And I'm not getting off the topic because it's getting at the long, outstanding, like, what's the impact of poor mental health? But that is the fail aspect. If you don't get your man, what's the worst case scenario of heart disease? It's death. So if you look at it from a continuum, you want to make sure your mental health and well-being is well addressed, and it's not only functional, but it's tested and it's field tested. And I do many, like this weekend, I'm doing with one of the fitness clubs here in New Brunswick, one on thriving on stress. And I did 4 or 5 webinars
Mhm.
for dealing with stress with a tool that you can evaluate what's your stress quotient, what can you do about it, and then the follow up without, trying to build a practice or anything, is okay. Let's get, a life skills coach or an approach, if you want, to what are we going to do about it once it's out. So Eddie, you were saying you and your wife, if you were to do an assessment, a self-assessment of your stress level, then you would see where are the sort of the areas in your life that need to be changed. What are you going to do about it? If weight
Right.
loss, I'm not inferring weight loss is an issue. Um, I would far think your hockey teams and choices would cause more stress than weight loss. But bottom line is, what are you doing about it?
Yeah. Well,
And
thanks. And that's so you're right, and you're so right, Greg.
controlling the controllables.
Right.
Control the controllables.
One final question for me, Greg, if I may. Um, if you had his ear, what would you tell Prime Minister Carney to do to help Canadians out with mental distress? What would you tell Prime Minister Carney if you had his ear?
Well, I it's funny that you should say that, because while he was running for the leadership, he secretively, no pun intended, came down to talk to Wayne Long. And I
Okay.
understand that he and Wayne Long attended our church on Sunday morning about
Hmm.
2 months ago. I go on Saturday night, so I missed them. But I would say to him, and I would say to the cabinet, that whenever you develop a policy, look at whatever policy you're doing with a mental health lens. When you look at it from that perspective, because we know in the province of New Brunswick, 32% of our province is in the realm of disabled. So what would that be in Canada? You have
Wow.
literally a third of the population that are not, and I'm not talking widows and people on fixed income, I'm saying the disabled population. So it's very important, with all the minutiae around about economic, what's the impact of whatever we're doing, homelessness, housing, whatever, what's the impact on the mental health and the mental well being, including those suffering from major mental disorders.
Okay. Thank you.
Greg, before you go, I flashed a couple of comments on the screen while you were responding to our questions, and I thought I'd just flash them up again. So if you had any comments that you could.
Sure, I
Okay.
don't see them.
Okay. So,
Greg, your information. I have lost my mother. Oh, I'm very sorry about that, Angie. My deepest condolences. My deepest condolences. And Angie, I would say to you very clearly that it's very brave for you to say that. And don't ever feel that you have to pull up your bootstraps and get on with life. Suicide and grief by suicide is what we refer to, particularly after 2 or 3 years, complicated grief. And it's very, very important to get a sound understanding of what is the grief journey. And there's groups all across Canada that deal with grief. Hope and Healing is a program that is quite common. And get yourself to a grief group to talk about what is the pattern of dealing with grief and suicide, so you can deal with the grief associated with suicide. But thank you very much for that. That was very brave of you. Ivanka, I, Ivanka. Yes, bang on. Both husband and wife disabled. They need support. Joe, you're bang on, and that's why I say it's very important to try to sift through the minutia and take control of the things in your life that you can control.
yeah, and just for anyone who may be just listening and not watching, Joe said, having come through the COVID pandemic, followed by increasing inflation across the board, it's no wonder people are stressed. Then, just when you thought things are easing, an orange threat is upon us. And he goes on to say, here we go. I understand the importance of a healthy diet, but unfortunately, a number of people can't afford the healthy alternative and succumb to junk food.
Absolutely true. And that is why many community groups, whether they be food banks or whatever, they have sharing clubs that help with the food purchasing and um, food supply is very, very important. Whether it be cooked soup and things of that nature, it's very important.
And we have one more. Thank you, Greg, for sharing your thoughts on how family members cope with suicide. It's the first time I heard that side of it. The truth is, there are so many levels of guilt, shame, and pain. Thanks.
No question, Diane. Bang on. You couldn't have said it any better. And the thing is, I have been after funeral directors galore all the time that make sure, and maybe not at a funeral because there's so much going on. You're so wrapped up in getting through, you tend to think, oh, I have to pull up my bootstraps for mom or whatever. I put my grief on hold for my dad because he was chip off. I was a chip off the old block. He was much quieter than I and very reserved, and he was a man of integrity. But I put my grief for my dad on hold, and it was 10 years after I was at a funeral and I was crying like nobody's business. Someone said, "Did you know that person that well?" And I said, "No." As the casket was rolling into the church, I was thinking of my dad and the fact that I had to support my mom, who was a widow. I put it on as a professional. I put my grief on hold, and I never grieved the loss of my dad, who died tragically with a massive heart attack in 1977. And I went 10 years. So people that have lost a loved one through suicide, beyond the guilt and the shame and the ability or inability to talk about it, um, they have all that time in between. So I would say in the province of New Brunswick, for example, we know 1 in 10 are affected by suicide. And when you think a family of 3 or 4, add that, there's well over 10 to 15,000 people that are impacted by suicide. And every province should have a program to help people through the grieving process, especially the suicide.
Angie says, thank you, Greg, for your support and response. It's definitely a process to understand.
Absolutely, Angie.
And Greg,
Not a
with
problem
that,
at all.
I think we'll wrap it up and allow you to go. Certainly want to thank you for sharing what you have with us today. And I guess, really, from a stress perspective, if I heard you correctly, a couple of things to consider: exercise, diet, and health.
And
Did I
sleep.
miss anything? And sleep. Okay.
Sleep. Sleep is a
Yeah.
big one because many, many, many people have sleep disorders and they don't even know it.
Hmm.
And when I talk about sleep, I'm talking getting a sleep disorder from the family doctor to find out how much REM you're getting, light sleep, uh, uh, heavy sleep if you want, all the layers of sleep you have to have for the body to recover.
Anyone in New Brunswick, if you want to reach out to Greg, he's not hard to find. You have a profile on Facebook for Gregory DZ and Associates, I believe.
Gregory DZ,
Yeah.
do it, or you can just Google my name, Gregory Zed, anywhere actually. Doesn't have to be in New Brunswick because everything's technical. You can Zoom anywhere.